Hi. Allergy shots or allergy immunotherapy is a way to treat underlying allergies to environmental allergies like trees, grasses, weeds, ragweed, molds, dust mites, cats, and dogs. It's been used for more than 100 years. They work great. They're more than 90% effective, especially when it comes to pollen and animal allergens. They're still also effective about 75 to 80% when it comes to dust mites and molds. Treatment regimens usually start off at very low doses with small injections given in the upper arm of the different allergens. Those are done on a weekly or twice weekly basis for the first couple of months. Then we go down to once a week for about a year and a half. We expect to see full effect and benefit from those shots within that time frame. However, we generally do not recommend stopping them at that time, as there's a high chance of the symptoms coming back as soon as those shots are stopped. So generally after a year and a half, we go down to twice a month for about 2 years, then once a month for about a year or so, and then discontinue those shots with success rates of more than 90-95%, even 10 years after stopping those shots. Allergy shots are extremely safe. They've been used for 100 years or more now. The only potential risk from the shot is a reaction, and that's why it's generally recommended that to receive those shots, you have to be in a medical facility in case there is a need for treatment of an allergic reaction. So in our patients, we generally have them stay about 15 to 20 minutes after they receive their injection, after which they leave, just to make sure, again, there is no reaction. We do give them for patients age 5 years and above, and we do give them through pregnancy with no adverse events, as the standard recommendation is to continue those shots during pregnancy. But of course, we do not increase the dose of those injections because we do not want to risk the potential of having an allergic reaction that we need to treat when a person is pregnant. It's of note, please note, many times people refer to once a season shot as an allergy shot. That is a corticosteroid shot. Those, although can work effectively, they do carry the potential for long-term risks, including the risks for osteoporosis, cataracts, glaucoma, among others. Most patients still need to take their allergy medicines for the first year and a half. However, after about 2 years or so, we start looking forward to tapering off some of these medications. Among the main indications for using allergy injections are patients who do not have adequate control with medications, or patients who do not want to stay on medicines that only treat symptoms for many years and would like to take care of their allergies. But among the most important one is anybody who has what we describe as allergic asthma. So anybody with asthma that generally flares up during spring and fall especially is a candidate for such treatment, as those shots can be very effective in alleviating the symptoms of asthma as well. Further, another indication is somebody who has recurrent sinus problems that require multiple treatment with antibiotics over the year. Controlling those allergies with allergen immunotherapy can have significant impact in reducing the frequency of such infections. And if any questions remain, please feel free to visit our website. You'll find additional information, or feel free to call us at any time. Thank you. Hi. Allergy shots or allergy immunotherapy is a way to treat underlying allergies to environmental allergies like trees, grasses, weeds, ragweed, molds, dust mites, cats, and dogs. It's been used for more than